Hi, I'm Dr. Brandon Elnekaveh. Today I'd like to talk to you about breast augmentation. There are 4 things to really think about with breast augmentation. Number 1 is whether you want to use implants or your own fat and what kind of implant you're going to use, silicone or saline. Number 2 is the incision placement. We can go periareolar or under the breast. Number 3 is the pocket placement, so where exactly the implants are going to be going, whether they're going underneath the muscle or over the muscle. And number 4 is whether a patient needs a lift or not. That's more for patients who have some droopiness to their breast, or they're not using a large enough implant to kind of get a lift that they're looking for. So there are different ways to augment a breast. We can use your own fat, or we can use an implant. When we're using your own fat, the key there is that you have to have some fat on the rest of your body where I have to remove that fat with liposuction and then place it into the breasts. The other thing to consider with fat grafting is that sometimes you're going to need multiple rounds because the fat doesn't really take. There's only so much fat that I could put in at once, and there's going to be some healing that goes on with that. So each surgery may be staggered by 3 to 6 months, and it may take about a year to get to the result that you're looking for. The other thing to consider is that sometimes the fat doesn't survive, and there could be firm areas underneath the skin from fat necrosis. In terms of implants, you can consider either a saline implant or a silicone implant. Silicone is filled with silicone. The saline has a silicone shell to it, and it's filled with saline. The advantages of a silicone implant are that number 1, they may be a little bit lighter, and number 2, they may have a little bit more natural feel. Having said that, I do have a lot of patients that ask for saline implants, and they're very happy and they feel natural as well. The drawback of a saline implant is that potentially there's a chance of rippling. That's when you can see the ripple of the implant underneath the breast tissue. A lot of times that doesn't happen if there's enough breast tissue or if we're going underneath the muscle, but with a silicone, that's less likely to happen. Lastly, in terms of rupture, saline implants, if they rupture, the saline is just absorbed and the breast goes down and we can put a new implant at a later time. Silicone, if they rupture, a lot of times those are contained and don't really cause any issues, and there's what's called silent ruptures. So the FDA recommends that after 5 to 6 years and every 3 years after that, patients get an MRI or an ultrasound if they have silicone implants. The next thing to think about is where to put the incision in order to put the implant into the pocket. With a periareolar incision, we're able to hide the scar at the edge of the areola which surrounds the nipple. With an inframammary incision, we're able to hide the scar underneath the breast. Typically, the incisions are 3 to 5 centimeters in length, depending on the size of the implant we're using. And of course, if we're using saline, we can inflate the saline implant inside the breast already, so the incision can maybe be a little bit smaller. For fat grafting, the incisions are very small, just big enough to allow a liposuction cannula to enter the breast in different locations. The third thing to think about is the pocket placement of the implant. The implants can either be below the muscle or on top of the muscle. On top of the muscle, there's this thick layer of fascia. It's a connective tissue that separates the breast from the muscle itself. And a lot of times I go underneath that fascia, so the layer between the breast and the muscle, and that protects the implant from issues, such as capsular contracture. Alternatively, when patients don't have a lot of breast tissue, they want a more teardrop shape, and they don't want to see the curvature of the implant itself, it's better to go underneath the muscle. For some patients, the issue with going underneath the muscle is that you can get what's called animation deformity. That happens when patients contract their pectoralis muscles and distort the breast tissue itself. And one of the ways to avoid that is to go underneath the fascia as described. The fourth and final thing to think about is whether you need a lift. Typically, if the breast is sagging low, deflated, we're not using a giant implant to really lift up on the breast, then you're going to need a breast lift. That's to avoid what's called a waterfall deformity. A waterfall deformity occurs when the implants are sitting high in one spot, but the breast mound actually is falling off of the implant. So to avoid that, we do a lift with the augmentation so that the breast actually sits on the implant in an upward and lifted position. To do the lift, we have to shape the breast around the implant, and that requires a few more incisions. One incision around the areola, one vertical straight down, and then sometimes one across the bottom, depending on how much tissue we need to take. What I love about breast surgery is that it's a creative process, it's challenging, and I get a lot of fulfillment by helping patients get to their final goals. The best part is everyone's starting point is different, and everyone's goals are different, and I'm able to tailor exactly what the patients want to get them to their final result. If you're interested in breast augmentation or any other plastic surgery procedure, click on the link below or give us a call for your free consultation.